It gradually destroys a person's memory. It wipes out the ability to learn and make decisions. It erases communication, making even simple words impossible to find. It robs people of living a normal life, and then eventually takes that away too. Alzheimer's disease is devastating and debilitating. As it continues to claim millions of people each year, and by the year 2050, it is expected to afflict 16 million in the United States alone. Alzheimer's disease does not discriminate. It strikes men and women of all races, all income levels, and all backgrounds. For the millions of Americans who suffer from it today, facing Alzheimer's disease isn't a choice. For the tens of millions of Americans who will suffer from Alzheimer's in the coming years, it isn't a choice. For the husbands and wives, children and grandchildren, and relatives and friends of those who are and will be afflicted, facing Alzheimer's disease isn't a choice. It's a reality we must face together.
I met her at the college, University of Vermont in Burlington. This woman got an AB after having 6 children in 1969 and teacher education, and she is a major factor in bringing the Montessori program to Arizona.
My mom was highly energetic, very personable, absolutely made you feel like the most important person in the world, extremely engaging. We started noticing different things that she would do, like leaving the coffee maker on or not shutting off the oven.
It does affect the life of the caregiver, since the whole schedule revolves around her needs. The needs to be fed, right, at this point, the need to go to the bathroom, the need to go to bed and be helped up in the morning. And right, she doesn't like the fact that she's unable to do these things on her own.
When my mother was first diagnosed, together with my brother, my sister, and my mother's sister, we sat down and had to make the tough decision that it was time to move my mom into a facility. Well, of course, having children myself, my biggest fears about the disease are that they will pass along to my children. I worry for everyone that, it's such a horrifying disease, and it's terrible to watch people's personalities completely be stripped away.
Alzheimer's disease is a significant problem in our society today. 10% of people over the age of 65 develop Alzheimer's disease. Almost half of the people over 85 develop Alzheimer's disease. By the time our young adults today reach the senior citizen age, there will be 16 million Americans who suffer from Alzheimer's disease at a cost per year of over $750 billion in today's dollars. It's a significant problem.
Alzheimer's disease takes a tremendous toll on families. At least 70% of patients with Alzheimer's disease are cared for at home at a cost of about $42,000 a year. The stress it exerts on families is also enormous. Caregiver burnout is very common. Many caregivers become clinically depressed, requiring medications in their own right. Alzheimer's disease does not stop getting worse. In its most advanced stages, patients become completely dependent. They're very susceptible to complications like pneumonias, falls, other illnesses. And accounting for all of these things as being related to Alzheimer's disease, it's been estimated that Alzheimer's disease may be the 4th leading cause of death in the United States. Our consortium is dedicated to finding better ways to treat not only the symptoms of Alzheimer's disease, but to better understand the causes and hopefully to treat Alzheimer's disease in a way that might prevent it from getting worse or even cure it.
In spite of the tragedy and heartbreak created by Alzheimer's disease and its devastating effects on our nation, there is hope. Hope in the form of the Arizona Alzheimer's Disease Consortium.
The Arizona Alzheimer's Disease Consortium is a statewide laboratory without walls designed to make a difference in the lives of patients and families with Alzheimer's disease.
The power of the consortium is really the fact that you have a number of investigators working together. No longer do you have a single group working on a particular problem. You now have 8 institutions providing specific expertise to the question that relates to Alzheimer mechanisms, Alzheimer treatments, and how to care for patients and family.
The Arizona Alzheimer's Disease Consortium includes world-leading genomics, brain imaging, cognitive neuroscience, basic neuroscience, treatment evaluation, and brain donation programs. Harnessing these scientific resources, the consortium has created a truly one-of-a-kind collaborative model to address the problem before it overwhelms us. Since 1998, the Arizona Alzheimer's Disease Consortium has published more than 1,000 scientific articles and generated more than 300 research grants. The consortium has been instrumental in pioneering new ways to identify effective disease-stopping and prevention therapies in the shortest possible time.
In the last few years, Arizona researchers have identified molecular mechanisms that lead to each of the microscopic abnormalities we see at the end of life in patients with Alzheimer's disease, providing new targets at which to aim new treatments. They've identified important risk factors for Alzheimer's disease. Researchers in our program have detected the earliest signs of the brain disease decades before the onset of memory and thinking problems in people at risk for the disorder, providing an unprecedented opportunity to find effective ways to prevent Alzheimer's disease without having to lose a generation.
The state of Arizona has remarkable resources, human resources. What's very exciting that's happening in this state is that many of us who work on various levels of understanding the brain, cognition, disease states, and how to treat disease states, we're all able with this consortium to come together and get ideas from one another and build on our strengths as scientists and clinician researchers.
I think this is a really great time to be doing research in Alzheimer's disease. Recent advances in technologies and new emerging methods to study the disease has allowed us to visualize the brain changes that occur in Alzheimer's patients in ways that we never could before. We now have methods to evaluate the genetics and other factors that could influence the development and the progress or course of the disease that will really ultimately help us to evaluate treatments and test new prevention therapies.
This is a terrific environment where I get to speak many different scientific languages with all of these scientists, and we're all glued together in a collaboration, pooling the knowledge that we have and trying to develop synergies that I think are going to lead to a viable, simple, inexpensive blood diagnostic for Alzheimer's disease, and I hope to have that in a year or two. Working together, our consortium has really made great strides in understanding the fundamental mechanisms of Alzheimer's disease and translating that into the clinic in terms of new diagnostics, in terms of new approaches to treat Alzheimer's disease. I think that's a great legacy that we working together will leave, the scientific discoveries that we've made. But more than that, I think what we really have given as a legacy that many other states are now seeking to emulate is this tradition we've developed of emphasizing translation and collaboration.
Clinical scientists in our consortium have been studying the emotional changes of Alzheimer's disease, making discoveries that help to better understand, diagnose, and treat the depression, anxiety, and agitation that so often accompany the memory and other thinking changes of this illness. Family members are the hidden patients in Alzheimer's disease. Studies have shown that over 50% of family caregivers may develop clinically significant depression, and others develop physical illnesses as a consequence of their caregiving burden. Investigators in our consortium have been developing and evaluating better ways to educate and train caregivers, helping them to lessen the emotional impact of providing care and giving them better tools to help manage some of the behavior changes that accompany this illness. Here in Arizona, Latino and American Indian individuals are often underserved and have poorer access to the kinds of support and services that can help lessen the burden of this illness. Our consortium, in partnerships with individuals from these communities, works to provide better outreach and education to persons in these groups.
I think that the major impact is going to be in the assessment of new drugs and new treatments. And the Arizona Center, because of this, is likely to become a reference center. I think that the major advances in individual aspects of this consortium, such as the imaging and the genetics, could well make breakthroughs which arise simply from the fact that the people in the consortium are competitive with others in the rest of the world.
Our statewide laboratory without walls receives generous support from the state of Arizona, from our participating institutions who believe in our cause and the strengths that we can bring to bear to address that cause, and from the NIH. Our Arizona Alzheimer's Disease Core Center, which is a part of our overall consortium, is considered the most extensive model of statewide collaboration in biomedical research.
In 1998, a group of men and women from different disciplines and different institutions around the state came together to work together to stop the progression and prevent the onset of Alzheimer's disease. Because of your support, they've already made great progress. Because of your support, there's hope that one day we will live in a world without Alzheimer's disease together.